Thank you very much, Mr. Speaker. My question is for the Premier. Tenants at Rebecca Towers in Hamilton is asking for help. The high-rise building is home to seniors, essential workers, newcomers, and working-class families, and it now has over 100 confirmed cases of COVID-19. The outbreak in the building has been growing since March, and it is located in a community that has a test positivity rate of 22%. Yet, this area is still not a provincial hotspot. My question to the Premier is, why were the tenants at Rebecca Towers left to get sick or die without the province acting to get this community more resources, more vaccines, and urgent help?
To reply, the Government House Leader.
Look, I think the honourable member for the question, as she knows much of the plan for this month, especially with the increase in vaccines that we've received from the federal government, has been to attack some of the hotspots across the province, hotspots that have been identified by both the science table and by the local public health units. What she raises is obviously very concerning, and I'm sure it's something that we will work with public health in Hamilton to address shortly. Thank you.
Supplementary question.
Thank you, Speaker. Not only are the tenants of Rebecca Towers facing a horrible COVID-19 outbreak, but they are also facing the consequences of this government's terrible housing policies. In the middle of this pandemic, the tenants are fighting an above-guideline rent increase, and the building has fallen into complete disrepair. With only one elevator in service and no regular cleaning of the common areas, it is no wonder COVID-19 is spreading so quickly. Rebecca Towers needs a safe building, and the whole community need their vaccines now. Why has the province allowed landlords to raise the rents and let buildings like Rebecca Towers fall into such a level of disrepair that it is making people sick and die during this pandemic?
Government House Leader.
Thanks again. Thank you again, Mr. Speaker. As you know, of course, throughout the pandemic, when there have been shutdowns and when previously we entered grey zones, of course, evictions were stopped across the province. We brought in rent freezes, Mr. Speaker. Obviously, it is very important when it comes to vaccine distribution that we hit hotspots, Mr. Speaker. As you know, and as the member opposite will know, the hotspots are the focus of our vaccine distribution plan for this month. It is very important, Mr. Speaker, as the Minister of Health has highlighted, that we get to these hotspots. We're identifying hotspots by working with local public health, but also working with the science table, Mr. Speaker. But I can assure the member opposite that we will certainly follow up with local public health officials in her areas. Her constituents deserve access to the same great vaccination distribution program that all Ontarians get. Thank you.